let's continue to talk about the vaccine and the rollout. And joining me to talk about it are Dr. M. Roy Wilson, president of Wayne State University, also an epidemiologist. Christina Zilke, down there at the bottom, is a registered nurse and the nursing supervisor at the Washtenaw County Health Department. And on the upper right, Portia Roberson, back with us again, the CEO of Focus Hope. Dr. Wilson, I've turned to you a number of times through this pandemic, so let me start with you. Really curious about your take on where we are in such a short amount of time to have arrived at the arrival of a vaccine, one that works very differently from vaccines of the past, which kind of seems to show us a little bit of the future of medicine.
Yeah, well, certainly it was very fast, and a lot of people are concerned about that. But I just want to, first of all, just assure people that just because it was fast does not mean that it's not safe. The reason why we were able to develop the vaccine so quickly is that years and maybe even decades of work have been going into the foundational research aspects that form the backbone of this vaccine, particularly on messenger RNA. And there were a number of people who have done real basic work, basic research on how messenger RNA can be used in diseases and make them stable enough so that it can be used. And the fruits of all that labor over these many years was just available when the time came for a vaccine to be made for this specific virus. But had there been a market for it, a vaccine would have been made using some of the same technology for MERS, for example. But that's the Middle Eastern respiratory syndrome. But that kind of petered out. That was in 2012. And no pharmaceutical company wanted to invest, huge amounts of money in developing a vaccine. That was when there wasn't a huge demand for it because it was petering out. But that same technology that was available then and would have been used to develop the MERS vaccine was used to develop this vaccine.
It is an important point that I'm not sure has been pointed out enough, that we did have these building blocks that were already in place that helped us get across the finish line here a little more quickly. But Christina, I'm curious, as you are talking now to, we'll get to other patients first, but as you're talking to your colleagues in the healthcare world, everybody eager to get this, or are you hearing some reluctance from folks who maybe don't want to be the first ones in line to try this until they see how it works among a few other people first?
I think there's a lot of people who are very excited to get it, and there is a lot of hesitancy. I don't know that of healthcare workers that I know and work with and have talked to that they're like definitely a no, but they do want to have these questions answered about safety and efficacy. And, additionally, these rumors pop up that these side effects or long-term side effects, about fertility, for example, they've heard that, but they don't know where the data is to research that or if it's true or what they should believe. I think it's difficult to find resources that are reliable. And so I think mostly I would say people are excited to get it, but there are a lot of people that have questions.
No doubt. And among those people who have questions now as we move into the broader citizenry, Portia, as we were just making the point in the segment before, the community that has been so badly hit, the African-American community by this virus, is also one that is poised to be pretty cynical about the government coming in and saying, here's some medicine that's really good for you. So how do we start to create the trust that's necessary to move us forward?
Well, I think the first thing we're going to have to do throughout communities is to rely on the experts, the people who have done this work, who are medical doctors, to give us more information. And that will go along with reassuring people that the vaccine is safe. I think the hesitancy is justified. I mean, we know there are disparities in healthcare amongst the African-American community. There have been for many, many years. And I think, we've also seen the significant effect it had on the African-American community with regard to COVID-19. So I think the hesitancy is somewhat justified, the skepticism. But I do think that skepticism can be responded to with physicians and others who give us information as that comes available.
Dr. Wilson, I continue to hear people who suggest that this works the way that old vaccines do, that it has the virus in it, and I don't want to take that. But then, beyond just a misunderstanding of the vaccine, I'll ask you the same question that I asked Denise Fair. When you hear someone like Louis Farrakhan call this vaccine toxic waste, what is your reaction?
Well, first of all, I was not aware that he had made that statement. I would say that it's very unfortunate that a public figure who has so much influence, particularly over the African American community, would make that kind of statement. The fact of the matter is that this vaccine has been gone through a process that's been more transparent than any other that I was part of the FDA advisory panel for 14 years related to drugs and vaccines and devices. And so, I've been involved with this process, and this particular process for the vaccine for both Moderna and Pfizer has been the most transparent that I've seen. Just as an example, the FDA does not have to call an advisory committee for an EUA, but they did, and that's going above and beyond. They extended the follow-up period also. I mean, there's both in terms of safety and in terms of, just the protocols. It's most transparent that I've been involved with, or I've seen actually.
Christina, and yet, as I said at the top of the program, there's a lot of people who don't want to own the first edition, say, of a new model car. Let's let the kinks be worked out. I mean, it's understandable if some people are going to want to be waiting, even though, as a nation, we say we have been waiting for this answer to get us past this.
I've heard a lot of people say they don't want to be the guinea pig, right?
Yeah. And
unfortunately, that's just, it's a feeling that, well, if I'm the first one to get the vaccine after it's been approved, then I must be the first one that it's been studied on. And in fact, we've had such a huge group of people that it's been studied on. The original setup for the vaccines, for Moderna and Pfizer vaccines, was to have at least 15,000 people into the studies for the trials, and it was actually closer to 44,000. So they not only doubled it, they almost tripled it. So we're not guinea pigs. The people who are getting this vaccine are getting a vaccine that's been tested. I think one of the misunderstandings is when you see, this approval process happen so quickly, it's that the safety risks have been taken out. And for all vaccines, always, safety has been a part of every, phase of each trial. It's never skipped, and it certainly wouldn't be now.
Portia, I think the last time you and I talked about COVID, you were having a hard time keeping track of how many people you know who have had the disease. I think you lost count. I'm curious as to whether you're eager to get the vaccine.
I am. I have seen it decimate my community. My father unfortunately passed away about 5 or 6 weeks ago. Right. He was, we don't know that it was directly related to COVID-19, but he had tested positive about 4 weeks prior. And so, I know that we all have to make this effort to tamp down this pandemic that has ravaged this country and really the world. And so I'm ready. I think I'll be ready when it's offered to me. I mean, I have the luxury of probably not being one of the first ones to get it because I'm not a frontline person and I'm not a healthcare worker, so I won't be offered it right away. So I'll have somewhat of the benefit, I guess, if you would say that, to looking at how it affects the people who are getting it right now. But I think that, for me, we've got to do something. Because what we've been doing for the last 9 months has not been working. And I don't know if that's because people won't participate. And obviously, we need people to participate in getting this vaccine for it to be effective. But I can't keep watching the numbers of people who are dying or the new cases every day. And, it's mind-boggling to me that people do not want to do everything they can to stop this thing from ravaging this world.
And I did want to quickly mention you. I know you've heard, Portia, from so many people with great memories of your father, who was a judge on the bench in Detroit for so many years. Dr. Wilson, are you eager to get the vaccine?
Sure. First of all, just as part of a societal obligation, I think, in order to really be able to beat this virus, about 75% of the adult population probably needs to have antibodies. About 10% will probably have it from naturally getting the COVID-19. So you need an additional 65 to 70% of the population to get it in order to, for this to work. And so if we don't take it, it doesn't matter that we have good vaccines out there that are highly efficacious in clinical trials. It's not going to be effective in the population if people don't take it. And so yes, I'm ready to take it and get out there and start being as normal as possible in terms of my daily activities.
In fact, you point, though, to another problem, which is people letting their foot off the brake a little early here because they know the vaccine's out there, even though it's going to take a while to get that around. Christina, as an RN, are you already scheduled to get it yet, eager to, or not quite yet?
I'm scheduled to get it, and I'm really excited. I don't have to wait for other people to do it because I will be vaccinating others and working in the vaccine clinic. Yeah, that's going to happen soon, and I'm really excited about it.
Good deal. Great conversation with all of you. I so appreciate the time. Merry Christmas and stay safe.
You too.
You got it.
Thank you. You too.
We'll wrap things up with Flashpoint right after this. Don't go away. This is Flashpoint on Local 4.